Hi, my name is Dr. Kathy Pereira, and I am the director of the Duke DNP Program. And I've been on the faculty for 11 years now, and am a Duke graduate of the FNP program in 2005 and the DNP program in 2012. I'm a practicing nurse practitioner, I'm a family nurse practitioner, and I work in the Division of Endocrinology in the Department of Medicine at Duke University Medical Center and still see patients 1 day a week. The DNP is a degree that was basically born out of a need for skills in implementation science and the translation of evidence into practice. And so it was first born by the American Association of Colleges of Nursing, and there was a convergence of factors in the early 2000s with the recognition of the need for healthcare redesign and the need for safe, quality, and cost-effective care that led to the birth of the practice doctorate, which is what the DNP is. The DNP has the critical skills that are needed to implement evidence-based practice into the healthcare system, to change systems of healthcare, and to evaluate systems of care and outcomes in groups of people, populations, and communities. In the Duke DNP program, you'll learn all of those skills and really come out as a changed professional and a changed nurse. So a little bit about the Duke DNP program. We first opened our doors to students in 2008. We are a distance-based program, and that means that you come to campus for 5 visits during the program. And it's a 5-semester program with 35 credit hours in the program. The on-campus intensive provide a great combination with the distance learning or the online learning that you do while you're at home. And the on-campus time is very lively, very interactive, where you're honing your professional skills, your presentation skills, you're debating the merits of your project with other students and faculty so that you can hone and refine your ideas with other people there to critique them. Also a great time to meet with your project advisors while you're on campus. Just the interaction with other students is very enriching. You get a lot of support from each other going through a difficult doctoral program, and you also learn a great deal from each other as we have students from all practice disciplines. We have students from the informatics area, we have nurse administrators, we have nurse practitioners in every field of advanced practice, including CRNA, primary care, acute care, pediatric care, family medicine, and nurse midwifery and psych mental health. So it's a very diverse group of students that come to campus together at the DNP at Duke. The DNP Project is really the culmination of the DNP degree and also a great focus of the course activities and the work you do in the DNP degree. The DNP Project gives the student the opportunity to create, hone, implement, evaluate, and disseminate a practice-based change, an evidence-based practice change. And all of your course activities really focus you towards the completion of the project. You turn in assignments that build toward that project, so there's a constant movement towards the culmination, which is the completion of the project. You choose a project advisor at the beginning of your program who is usually an expert in some aspect of your project that can provide you with advice, and then you also create a committee of an expert at your practice site where you're implementing the project, and also another subject matter expert. So why should someone choose Duke? Well, there's lots of reasons for that. First of all, we are number 3 according to U.S. News and World Report. This is the first year in 2016 that they've ranked DNP programs, and we're number 3. We're very proud of that. But really what that ranking speaks to is the amount and level of resources and support that are available for our students. It speaks to the expertise of our faculty and the recognition of the high level of scholarship that our faculty is able to attain. And as a student here at Duke, you can avail yourself of all those faculty resources and all of the support that the school has to offer. In addition, our students are given resources and support around writing and editorial services. We have a statistician that works with our students to help them hone their statistical methods as they create their project. We also have great IT support, and our IT system makes it possible for us to deliver a high level of curriculum for when you're doing your online activities. So that's about the school. But what are our graduates doing? And I think that's a big question that many people ask. Our graduates are doing amazing things. The skills that you get here at Duke really can be transferred and applied to any healthcare setting. Our graduates are chief nursing officers of healthcare systems. Our graduates are leaders of advanced practice provider groups in large medical centers and healthcare systems. They are really redesigning care, and they're looking at it from all different aspects. We've had our graduates go and testify and speak at think tanks for the Institute of Medicine in Washington, D.C. They are talking with policy workers in Washington, D.C., and when you go through this curriculum, you get the confidence and the skills and the expertise to be able to do this. But they're not only at these big and glamorous places, or what you would think would be glamorous places, but they're also in other settings that are out of the way. We have one graduate who is over in Tanzania right now, and she's implementing evidence-based practice to the midwives in Zanzibar, Tanzania. She's actually reducing the infant mortality rates in that country because of her practice implementation, and that's just amazing. We have students who go back to their rural areas where they're practicing in very small settings, but they have the skills to look at their care delivery in a different way and to implement change and to redesign it into a more efficient care delivery model, one that's more cost effective and sometimes more profitable for a practice and creates better patient satisfaction. So our graduates really are doing amazing things, and I'm really proud of our graduates. And stay tuned for more stories about what our graduates are doing. If you're interested in getting more information about our programs, you can go to the Duke School of Nursing website, which is www.nursing.duke.edu. There is a tab there for the DNP program. There's information there on our curriculums, admission procedures, and more questions about logistics of application and being a student at Duke. Thanks.